In exactly 2 hours from now at 10:30, India's final crushing blow on coronavirus will begin. The nationwide vaccination drive will kick off from Kashmir to Kanyakumari. At least 3 crore frontline workers will receive the first shot of either of the 2 COVID vaccines. And today alone, you're going to see 3 lakh people being vaccinated. That's the target set by the government. Preparations are on in full swing. What we're looking at is a final leg of preparations with just hours to go for the vaccination drive. 100 people or so will get vaccinated at each centre every single day. Union Health Minister Dr. Harshvardhan also reviewed the preparations last minute yesterday. He visited the dedicated COVID control room that's been set up at the Nirman Bhavan premises of the Health Ministry. Remember that there's a 24/7 call centre that's also been set up to address all concerns, any loopholes or hiccups in the vaccination process. Now, this drive was preceded by pan-India drills across all states and union territories to identify any issues with the process that has been put in place. 2 dry runs have been conducted across the nation and they've essentially gone by smoothly. So the government is hoping that today when the vaccination drive kicks off, everything goes as per plan.
दुनिया का सबसे बड़ा कोविड का वैक्सीनेशन प्रोग्राम, उसकी शुरुआत भारत में हो रही है। मैं पूरे विश्वास के साथ कह सकता हूं कि आने वाले समय में जो प्रक्रिया शुरू हो रही है, इसके कारण ये शायद इसको मैं अगर कहूं कि दिस इज़ द बिगनिंग ऑफ द एंड ऑफ कोविड।
Let's get you details of what's happening in every city in the country ahead of the vaccination drive. I want to first take this across to Milind Sharma. She's joining us live from the Rajiv Gandhi Specialty Hospital in New Delhi. That's where the vaccination drive will be beginning in 2 hours from now in the national capital. Milind, good morning. Last few months, you've been getting us every update with regards to the coronavirus vaccine. It comes down to this day now. The vaccines, we're just hours away from the vaccines being administered. Just tell us really what is the target that's been set. We know that 3 lakh frontline and healthcare workers will be vaccinated today. How many of those will be in the national capital?
Well, Akshita, yes, finally the V-Day has arrived for India and throughout the country, not just in Delhi where I'm reporting for, throughout the country is going to see 3 lakh healthcare workers be vaccinated on the day 1. So we are in the vaccination center and behind me are the vaccine rooms as well as the emergency rooms that have been readied by the administration of the hospital. You can see on one side where the vaccination officer 2 will be seated. There's a CCTV camera. For security purposes and sanitation purposes, at this point we're not given access inside, so that is going to be the security protocol. Outside here there are people who are waiting, there are officers who are waiting for the first batch of vaccines to arrive over here in this particular center, and outside is the observation room. At this point there's a list that's gone out of healthcare workers who will be vaccinated on day 1. So that list is something that will be referred to when the healthcare workers line up one by one. We're going to look at the launch after Prime Minister Narendra Modi addresses the nation, and in various centers there are going to be staggered timings to maintain social distancing as well, to make sure that there's no overcrowding in a center. Remember, 100 is the capacity at which the government estimates that each and every center should be able to vaccinate people, and we are looking at hectic preparations that are still going on in each and every center, Akshita, before the time at which the vaccination will begin, and that'll happen once the Prime Minister speaks to the nation at around 10:30.
So last minute preparations, last minute reviews. Let's keep our fingers crossed that everything goes smoothly. We've seen dry runs happening and those largely have been very, very efficient. Things have gone by very smoothly in those mock drills that were conducted twice across the country. We're getting you reports from every single part of the country because today the vaccination drive is not just going to be limited to 1 or 2 cities. It's going to be a pan-India exercise that kicks off today. I want to take this across for a quick update to Pramod Madhav, who's joining us live from the Madras Medical College in Chennai. Pramod, what are the kind of preparations that you see on the ground? You know, the vaccines, while being kept at different areas, are being transported to the hospitals from early this morning. So a lot of hectic preparations, I'm sure, last minute that's on the ground.
It absolutely is, but as you might know, Tamil Nadu is already known for the kind of medical qualification and the kind of medical ability it has, and that's the reason everything's up to the mark. In fact, we earlier showed about the presence of all the kind of equipments and such in the vaccine bay, and here currently we are showing the people who have volunteered, the frontline workers who were fighting COVID-19 for several months. They have also volunteered now, and this is what you could see. This is a waiting room. In fact, one of the volunteers here, her name is Priyanka. Thank you for talking to us. So you also volunteered for the vaccine here. Which one have you opted for?
I've opted for Covaxin.
And any reason behind it?
Covaxin has been in practice for a little bit longer time than Covishield, and Covishield, if I'm not wrong, it has had one side effect for a patient, but they have still proved that it's not due to the vaccine. Still, for a better sake, I've chosen Covaxin.
How do you feel about getting the vaccine on the first day of the drive?
That is a little... what do you say? I am little anxious. Yeah, you're right. So, but however, what I felt was one day or the other, I think all of my colleagues are going to get vaccinated. So why not the first day? And it is not very new. It has been tested for quite some time, and it has been in practice in other parts of the world. So it has been started first here. So I think I volunteered for that.
Well, first of all, we thank you for your service, and the next thing is that you also opted for the vaccine currently. So what is it you want to tell the general public about the need of this vaccine?
Yeah, actually, first we are fortunate enough to have received the vaccine and made it available for everybody as of now. So in spite of getting vaccinated, it is very important to be precautious, wear masks and maintain social distancing. So vaccine is not the 100% solution to the current situation. It is just you to have a better upper hand. So vaccine, as we all know, it is going to just prevent very severe infection. It is not going to completely prevent infection, and it is not like today we get vaccinated, tomorrow we'll be completely free from COVID. So that should reach the general public. That should be in their mind. So it is not a thing that we get vaccinated today, tomorrow we can throw away our masks and go roam about everywhere. So that's not the point. So the point is, it's just for us to prevent a very serious, severe infection of COVID. So only for that mainly for that we are getting vaccinated. And as we all know, the efficacy is tested for up to 6 months max, and we are not sure of the efficacy after that, and we are not sure of the efficacy regarding new strains of the vaccine also. So yeah, we always should keep in mind that the strain can be mutating every time, and so we are not completely protected, but we are just making sure that we are not going to be acquiring a very serious infection from the vaccine.
Well, that's a valuable advice. Thank you so much for that. So as you heard from her, just like the vaccine is not the only thing, you still have to maintain social distancing norms, and that's the first thing, is that you have to wear a mask and you have to maintain social distancing, and that way only you can actually fight COVID-19. In fact, this is a kind of preparation you could see at this location, or even have security guards at the place. Anytime the vaccine is going to come at that location, and the thing here is that in this hospital we have two bays, one for Covaxin, which you see over here, and the other one is for Covishield, which is at the background. The dean of the hospital is also expected to get vaccinated today, along with the Oromo, and there you have the bay as well. All preparations done. Anytime we can initiate the vaccination process.
Okay, good to see that all preparations are in place. Pramod, request all of our reporters to stay with us.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.